Well, for those of you who don't know me, thank you for the introduction, Tony. My name is Joe Walker. For those of you who've seen this presentation before, guess what? It's feel like deja vu. Was it deja vu all over again? Probably same jokes, same thoughts, same comments, but that's okay. Repetition is what makes it great, right? So we're going to go ahead and dive into this. I know how much time do I have, folks? What time do you want me to shut it down, Tony?
You got about 45 minutes. Take the time you need.
Well, good. Then I can talk slow. Okay, so I always start off my meetings, folks, with this comment. I've got good news and I've got bad news. The good news is the future's in your hands. The bad news is the future's in your hands. Everybody on this call is an entrepreneur. Every single one of you here this morning have taken the time and made the decision to join this meeting because you are an entrepreneur and you want to work and grow your business. And our business, folks, make no mistake about this at all. Our business is only serves one purpose, and that's to change lives and save lives. I know that's two things, but that's the same overall purpose, is to change lives and to save lives. And I use this platform every single time to make sure people understand where I'm coming from. Is simply this: if you are here just to make money and not to help people and change their lives and save their lives, then they've got this great new invention. It's called the door. Use it and don't come back, because we're not about padding your pocket. We're about changing lives and saving lives. And in the process, folks, you are going to be blessed beyond compare. You're going to be able to provide a lifestyle that you and your family so richly deserve, but the priorities have got to be right. But, and also what I want to talk about this morning is two basic things. First of all, it's life's about opportunity. If you stop and think about it, every single person, it doesn't matter what their state in life is, they've all had opportunity. Somebody that's homeless or maybe hasn't succeeded in life, maybe they didn't take the opportunity for proper education. People like Tony have seen opportunity. When he was down, at the worst point of his life, he saw an opportunity and seized it, and now he's where he's at today. So life is all about opportunity. And what's being presented today to you as an entrepreneur is an opportunity to help 10x your business. It's also the opportunity to change and save the lives of the people that were willing to sacrifice their life so you can go ahead and seize opportunities in the greatest country in the world. But life is also, while it's about opportunity, choice is power. If I came to you and I said, look, you've got your choice of chocolate, or chocolate ice cream, which would you prefer? Chances are you're going to choose chocolate. All right, so there's no power in your choice. But as soon as I come up and say, hey, I've got a box of Neapolitan ice cream here, or carton, which flavor, now you've got the power to choose. So and choice, having a choice in what you're doing, what's available to you, empowers you to move forward in your life, in your healthcare, and to move forward within the opportunity. And you're going to see within this opportunity known as the veterans opportunity, you're going to see a lot of choices are going to be available to us. But let's start talking about the veteran opportunity. But I want you to think about those two concepts while we're going through this presentation. First of all, the demographic. This is something that startled me, folks. Seniors for the last 2-3 years have been forced into being sequestered within their own homes. And while they've been there, they've been completely inundated with J.J. Walkers, Joe Montana on the screen constantly. They can't watch an episode of Bonanza without watching 500 commercials about Medicare and how they can get all their money back. Or they've had phone calls to where every time the phone goes off, they got a nervous twitch now, and they sure as heck don't want to talk to people face to face about Medicare. And it's because they've been so inundated with Medicare over and over and over. The good news is they're starting to come out of those cocoons that they've been in for the last few years, coming back out into the real world, and they're being able to just get away from that constant barrage of information and data overload about their Medicare and enticement. So now that's starting to wane away, and some of the callousness is starting to fall off. But the good news about our industry, while there might be some market fatigue within our industry, there's never going to be market saturation, folks. We got 11,000 people joining our Medicare rolls every single day. And out of this is something that surprised me. With this slide, we're seeing that over the course of the next 5 years, there are going to be 360,000 veterans turning 65. You're looking at one right now. In July, I'm going to be turning 65. I want to enter into the Medicare program if I can find an agent that can put up with it. We'll see what happens there. I don't know if there's any volunteers.
I can help you with that, Joe. I can help you with that.
I can be bought for the right price. But anyway, so folks, the point I'm trying to make is that we got to get away from the fact that there's not opportunity. There's opportunity everywhere. And the biggest thing about our veterans, and everybody on this call, if you've been in Medicare for more than a minute, or if you've been here since Moby Dick was a guppy, it doesn't matter. Every single one of us has always heard, until recently, that if somebody's on TRICARE For Life or somebody's on CHAMPVA, treat them like a dead skunk, don't touch them because it's just going to stink things up. So just leave them alone. And folks, nothing could be further from the truth, and I'm going to give you empirical evidence to prove that. So you have a choice. This is an opportunity to help 10x your business by seizing the opportunity of the availability made to you to help veterans change their lives and save their lives. And the choice is, how do you want to work that? What is your strategic initiative to help these veterans out? And I'm glad you asked what that means, because we're going to talk about it. Anyway, I want to move on. The biggest problem that veterans have had, and all of us, I'm sure we're familiar with this, it was on the news not too long ago that veterans were just neglected. They would go to the VA and they'd have to wait months, years. Then the service was substandard. You had so many things going on that were going against the veterans. Veterans were committing suicide, because they'd rather commit suicide than go through the pain and the suffering they were going through. Well, finally, and folks, I'm not here to talk politics, because politics just don't matter. It's about my troopers and them being taken care of and cared for. That's all that matters in this whole thing. And so during a certain administration, they came up with what was known as the Mission Act of 2018. And folks, I'm not going to insult your intelligence by reading these slides. You're more than capable of reading these slides. This is going to be recorded. You can look at this at your leisure, and we may be able to send you a slide deck. If there's somebody on here that can't read, we got a whole deck of slides with just pictures. But that's for my Marine buddies out there, right, Eddie? But anyway, just kidding.
Hoorah!
But the Mission Act of 2018 came about because veterans weren't receiving the quality of care that they deserved. It was taking them months to get seen by a doctor. They had to drive, to Saskatchewan almost, it seemed like, to go ahead and get service. So they came up with a program, and it's called the Community Care Network of Doctors. And it was implemented in 2019 in July. But because of this, now they've got a network of doctors outside of the VA that is available to our veterans. So now they don't have to worry about waiting months to be seen, or there's going to be more variety for them to go through. But the one caveat to that is the person that's still in control of this program is the VA. So they still are giving them a path to run on, an opportunity, but it's going to be controlled by them. Now, some of the things that the veterans are available to have through the Community Care Network that you're not going to get through Medicare, which now that I am going to be on TRICARE For Life, I take advantage of some of this is hypnotherapy. I think that probably happened to me before. I just don't realize it. Massage therapy, definitely need that after a long week of talking to folks. Native American healing, I'm gonna get my spirit animal, and Tai Chi. So so they've got availability of healthcare, which is going to even be more opportunistic for our veterans, which is a good thing. But the biggest thing what's going on here? It's not working. There we go. The biggest thing about our veteran network is that for the longest time, the doctors were not trained on how to deal and work with TRICARE. That's why we had so much resistance, and that's where the myth of don't deal with people on TRICARE or CHAMPVA, that's where that myth came up, that you're not to help them with Medicare options because the doctors didn't know how to go through that process of helping veterans with their TRICARE and their Medicare Advantage plan. And because of this Mission Act of 2018 and the advent of the Community Care Network, now all of that has been taken care of, because now the doctors are trained on how to dual bill Medicare Advantage plan and TRICARE and CHAMPVA. And we're going to see here in just a minute that none of those rules apply to people that are using just a VA. So the standard veteran has three options. One, VA coverage. Those are people that are not retired or entitled to CHAMPVA or TRICARE For Life. So that's going to be for the standard coverage, and we're going to talk about the guidelines on that. TRICARE For Life, those are for folks like myself that are retired veterans. They as part of their retirement package, and this is applicable to their families. CHAMPVA is for the spouses of veterans that are 100% disabled, or there's some other qualifying factors that are involved, and that also extends to their children that are under the age of 26. Once they reach the age of 18, they have to prove that they're in a scholastic program of some type in order to stay on it. But folks, one thing I do want to let you know is that this is going to be about a 50,000-foot overview. We have full training on this, but I just want to whet your appetite as to what's available. So let's look at this first organization, this first opportunity for our veterans, the Veterans Administrative Healthcare. First of all, one question I like to ask is, what's the purpose of the VA? And this is going to be important to you as an entrepreneur. It's also going to be important to our local assistants through the VSO, service-connected organizations. VSO is Veteran Service Officers and offices, service-connected organizations. This is going to be important for us to all understand that the sole purpose of the Veterans Administration is to find benefits for our veterans. If that's it, nothing else. That's their sole purpose. How can we serve these people that served us? So keep that in mind as we're going through this opportunity and what we're going to do. Hopefully we'll have time to talk about how we as individual agents and entrepreneurs can leverage this in our strategic plans. So again, the biggest thing that we need to look at is VA healthcare is part of the Veterans Administration. It's benefits that are available to veterans. Not every veteran qualifies for these care. And as we're going to see here, based on what their needs are, they can fall into one of 8 priority groups. Now you'll notice under priority group 1, veterans with service-connected disabilities rated at 50%. I actually fall in a different category, but I would qualify for this because I'm 60% disabled. So people that have that disability or level of disability could fall into priority group 1, but there's some other factors that have to take place that they have to take into account, decide what the actual group is. But it goes all the way up to priority group 8. And now when you start seeing priority group 8 participants, you're talking about they have a higher gross income, but there may not be a service-connected disability like with me. But the fact is that they're going to have coverage, but they'll be paying co-pays. They're going to be inpatient hospitalization co-pays. Their drug portions are different. So it gives us opportunity, and we're going to talk about that most. In priority group 1, veterans rated at least 50% disability or disabled do not pay co-pays. Veterans do not pay for medications in priority group 1. So if you put somebody, now you can, with the Medicare Advantage, with them using the VA healthcare system, meaning they're not TRICARE or CHAMPVA, you can put them on an MAPD, but they're going to be co-pays for their prescription drug plan. If they go outside the VA, they're going to have co-pays. So long as they use the veterans coverage at the VA hospital, at the VA clinic. If they're priority group 1, they will not have a copay. If they don't like the doctor, they can make the adult decision to use their Medicare Advantage plan outside of the VA, but there's going to be copays. If they decide to use their prescription drug plan and not get it certified at the VA to use their VA or VA covered drug program, there will be a copay. This is called making an adult decision, and they have to decide what they want to do. Priority groups 2 through 8, again, we talk about people with more income. There's going to be some other opportunities there that's going to provide them to fall into these different groups. So now with the medications, you see a limit of $7,000 annual, or I'm sorry, $700 annual cap on their medications. So now you put them in an MAPD, and now they're going out there and they've got, diabetic issues, they've got other blood pressure issues, whatever. They're not going to be your friend, because they've gone from paying a maximum per year of $700 to a coverage gap or a donut hole that exceeds $7,000 a maximum out of pocket. So you have to look at this by case. And here's another thing that separates VA healthcare from the other two other opportunities. The veteran is not required to have Medicare Part B to participate in this healthcare program. They have A because they've automatically qualified for A. So you're going to see a lot of veterans out there, all they have is Medicare Part A. Well, that's because they qualified for it already by paying their FICA taxes and Medicare taxes, but they are not required to have Medicare Part B. Therefore, because they are not required to have Medicare Part B, the VA program that they have, healthcare program, is not considered credible coverage. So now the prescription drug plan is considered credible coverage, but not the healthcare. So now when we talk to a veteran and we get them all jazzed up and excited about all these additional benefits they have, like dental, vision, hearing, over-the-counter food card, gym membership, transportation in some cases, or a Part B give back, they don't have Part B, all of a sudden they're all excited about it, and they've been in the healthcare system, the VA healthcare system, for 5 years. They've been over the age of 65, they're 70 years old. They're going to have a penalty on their Part B premium of an additional 50%. And now they've gone from $164.90 to whatever another 50% of that is, 100 and whatever, or 200 and whatever dollars. But we have to understand, this is why we're benefits advisors and not salespeople, because a benefit advisor is going to look at this individual on an individual basis and do a comparison between what they're investing and what they're receiving. What's their return on investment? Well, it may be worth, especially with most programs having a Part B give back, to go ahead, which eliminates that penalty in a lot of cases, and then even still chops down some of the Part B premiums, to go ahead and have them enroll in Medicare Part B, pay that penalty, let the give back soften the blow a little bit, because the benefits are so great. What so many people don't understand, a veteran might be rated at 100% and have great dental coverage, everything, but it's all based on space availability. If the space availability is not there at the VA, they're not getting the healthcare coverage. We have people, we have a great VA system here in Biloxi, fantastic. And they didn't have a dentist for 2 years. Guess who didn't get their teeth fixed? So, it's important, folks, that we understand. Again, this is a 50,000-foot overview. The point of this whole exercise here is to know that veterans that have or use the VA system of healthcare now have opportunity through the VA to go out into the community, so long as it's approved, and see doctors out in the community. But they also don't require to have Medicare Part B. And if they do, enroll in Medicare Part B at some other point, there's going to be a penalty. And then we see the guidelines here on the screen of how this is going to impact their drug coverage and their regular coverage. There's some advantages and disadvantages. I don't want to take the time to go through this. You can see this, when you look at it, at your leisure. But there's some great opportunities for them to be on a VA coverage. The value, again, folks, I can't stress enough. If you get into the priority level 7 and 8, it's like having a Medicare Advantage plan without the additional benefits, because there's going to be an inpatient hospital copay. There's going to be a visit, or they're going to have to pay a premium to go see, a copay to see their primary care doctor and specialists, emergency rooms. So we're basically augmenting that with a Medicare Advantage plan, which could be cheaper if they go out in the real world, and it's not violating. They're completely sanitized from one another. The VA does not coordinate benefits with Medicare Advantage and vice versa. But some of the advantages are you're going to have no copays and additional benefits. And again, folks, we talked about the two things, opportunity and choice. Life's about opportunity. We're giving them the opportunity to better their healthcare coverage. It is their choice whether or not they take advantage of it and how they're going to use it. Some people feel that they're stuck, in the, using the VA system when they're not. With the Medicare Advantage plan, they go out, come in, go out, come in, and so it's going to be advantageous for them. And again, we see some of the additional opportunities for coverage. I hope I haven't put anybody to sleep yet. I know I don't want to take the time to review this, but they've got 3 options with the VA healthcare coverage. They can enroll in both the VA healthcare and Medicare, and you're going to see some of the advantages. But the biggest point, again, I want to say or point out is that if we look down here at this bottom portion, that the VA and Medicare do not coordinate coverage, and Medicare does not interfere with their VA benefits. And that's any type of VA coverage, folks, whether it's just their original Medicare or Medicare Advantage, because again, those 2 silos are isolated. Their second option is to enroll in the VA only, and then they're going to have to use the medical benefits package for their drug coverage. So they can have that drug coverage and not be enrolled in Medicare, or not even be enrolled in the VA program. And again, there's a lot of minutia here, folks, that we got to muddle through to get a better working knowledge of these 3 options. They can be enrolled in Medicare, and Medicare does not affect VA drug coverage. And again, there's certain things that have to be in place to take advantage of that. We don't have to have the time to talk about the nuances of this on the regular call. We will, or the regular training. We'll talk about the nuances of this. So this is just, again, some of the healthcare summary for the VA program. They're using VA benefits. So please, when you get a chance to look at these slides, take some time to go over that. TRICARE for Life. My big baby right here. Love me some TRICARE for Life. TRICARE saved my life. But let me tell you a little bit about myself. I was running and gunning. I was in security forces. I was part of a weapons team. Decided at the age of 42, 43, I was a lot slower and a bigger target than my 18-year-old, gunner in front with me. So I became a recruiter, got stationed down here at Keesler Air Force Base after Katrina to start the recruiting effort again, and suffered a major heart attack. Heart stopped for about 30 seconds, slept in a pacemaker, 4 stents, and all this other nonsense, and said I couldn't play anymore. So I was forced into retirement after 26 years. TRICARE for Life, Keesler Air Force Base TRICARE for Life has saved my life. There's no way at the time that I could have afforded the health care or the drug coverage if it weren't for TRICARE for Life. So I'm on TRICARE for Life because of my medical condition, or I'm TRICARE Prime currently because of my medical condition, and because of my retirement, it's going to transfer over to TRICARE for Life in about 2 months. TRICARE for Life saved my life. Keesler Air Force Base, I wouldn't go anyplace else except Keesler Air Force Base if I got a cardiac situation. But if I have a cancer situation where I'm in the fight for my life, and so I'm either going to go to MD Anderson, I'm going to go to Ochsner, Cancer Centers of America, Cleveland Clinic. I'm going to take control of my health care. Well, I'm either going to pay out of pocket. Well, TRICARE For Life will pay some, possibly. Or I could have the option of choice, which empowers me to go and use my Medicare. So, and again, we can talk about the nuances of this later on. But TRICARE For Life, okay, is a viable program that can be used with Medicare Advantage. And I'm going to prove that here in just a minute. Okay, so TRICARE For Life. Okay, TRICARE is just like a wraparound, like a supplement, and is used with the Medicare Part A and Part B. People on TRICARE For Life and CHAMPVA must, that is MUST, must have Medicare Part A and Part B. If you do not have Medicare Part A and Part B, you will not have TRICARE For Life. You will not pass go. You will not collect $200. You will be in healthcare jail until you sign up for Medicare Part A and Part B. Okay, it's just that simple. So again, now what we have to look at is Medicare acts like a supplement with their TRICARE. So you got Medicare here, TRICARE here. Whenever you use your Medicare, TRICARE is alerted and they come and they fill in the holes of what Medicare doesn't cover. Okay? Just like a Medicare supplement. Now, if you're here in the U.S. or its territories, Medicare is always going to be the primary. Overseas TRICARE is going to be the first payer. With this, the doctors, again, because of the Health or the Mission Act of 2018, have been spun up on what TRICARE is all about, what CHAMPVA is all about. Most of the doctors, the network is huge in the community. So now they know that when they use their Medicare and they have TRICARE, the doctor pays or bills Medicare, and he also bills, or she bills TRICARE. Okay, so now because they're isolated but working together, when we start talking about Medicare Advantage, it impacts only the Medicare portion, the original Medicare. So now when we enroll somebody into a Medicare Advantage plan, we're actually lowering most, if not all, of their copays, except for a couple. We're reducing that. So now when the doctor sees that Medicare Advantage plan, he or she will go ahead, or they will go ahead and bill for Medicare. And when they bill for TRICARE, TRICARE is looking at it and saying, oh, wow, we owe less than what we did for somebody. Well, yeah, of course we're going to pay. And they pay because TRICARE is now paying less. But now the beneficiary or the veteran has all of these additional benefits, plus, in most cases, a reduction in their Medicare Part B. So think about this. With the VA person that uses the VA benefits, they may be on VA coverage for 5-10 years before they see about anything about the Advantage. They're going to pay a penalty. They're required by Medicare by TRICARE to be on Medicare Part A and Part B. So that means the maximum you're paying for your premium is $164.90. So now if you got a give back of $75 like we do here in the South, now when I enroll in July, instead of paying $164.90, I'm paying $89.90. I'm happy all day long. That's because I'm enrolled in that benefit, plus I'm or that plan, and I'm getting all the additional benefits. So if TRICARE For Life was not to partner with Medicare Advantage, if that was, again, we're supposed to treat TRICARE For Life when it comes to Medicare Advantage like a dead skunk, don't touch it, then I got a question. Why in the TRICARE For Life handbook are they talking about how Medicare Advantage pairs with TRICARE For Life and what to expect? That's one of those things that make you go, And it's been like this since Moby Dick was a guppy. It's always been there since Medicare Advantage has been around. Why? Because now Medicare is not managing their health care, the carrier is. Plus TRICARE has to pay less, for the same coverage. Plus it's because of Medicare Advantage, there's a lot of safeguards in place with the Medicare Advantage. So TRICARE is doing their fat man happy dance because they're not having to pay as much and able to keep more of the money for other things. So it's an advantage. And again, we'll let you have the time to look at this at your leisure. Folks, there's still some doctors that, the technical term for that is called chuckleheads that don't understand that they have to, that's a Greek term, they have to go ahead and dual bill when a TRICARE recipient comes to their office and they have a Medicare Advantage plan. So they'll bill the Medicare Advantage plan, but they don't bill the TRICARE program. And so now the beneficiary is left with a copay. Well, let not your heart be troubled. Everything is okay. Because if the hard-headed, uneducated, unwilling doctor is not willing to dual bill like they are supposed to, lo and behold, we've got an answer to go ahead and rescue the perishing. It's called a DD Form 2642. It's just, you're looking at it. This is it. And if you can see it on the screen, the only thing they have to worry about is the shaded blue areas. You can fill this form out in 30 seconds twice. It's just that simple. It's who you are, where you went, what you spent. You attach the documents, send it, and the reimbursement fairy sprinkles you with fairy dust, and all of a sudden, you got your copay back in about 10 days to 2 weeks. It's seamless, it's harmless, but folks, it will be the major source of consternation with your customer, and they will want to eat your eyeballs if you don't tell them about this first. Be proactive, give them a copy or a couple of copies of the DD 2642 and say, hey, look, there's some chucklehead out there. Isn't going to go ahead and process this? Lo and behold, we got the answer. It's just that simple, folks. So, but one other thing that I skipped, so forgive me, but with TRICARE For Life and CHAMPVA, you must, absolutely must, with a capital M, must, is focused only on Medicare Advantage. Never, ever, ever. Everybody repeat after me, get off microphone and take this vow. I shall never place a TRICARE or CHAMPVA person in a PDP or standalone prescription drug plan So help me, Shania Twain. All right, guys, if you put them on an MAPD or a standalone PDP program, they will hunt you down and they will run you over with their car. Because now they're going to lose their meds by mail and they're going to have copays. So congratulations, you made a big mistake. Do not. You only put TRICARE and CHAMPVA people on an MA only, period. Okay? I don't come back. Well, what about this? What about that? This is one of the few absolutes where you put them on. If somebody would come to me and say, well, I want that prescription drug plan, you're on TRICARE For Life. I don't care, I want it. Go see somebody else because I'm not helping you. That's how strong I feel about that, because you will be sowing many sorrows. All right, enough about TRICARE. Here's a gee whiz slide about, oh, look what the difference is. So, and then CHAMPVA. CHAMPVA is going to be basically for survivors. People that are 100% disabled. There's certain other qualifications. If you're killed in combat, the family can be placed on CHAMPVA. Not going to go into a lot of details. We'll talk about that at a later date. Plus, tough to talk about. So anyway, so with CHAMPVA, again, they have to have Medicare Part A and Part B. This is for the spouse and dependent children up to the age of 26. At the age of 18, if there's a dependent child on there, they have to prove that they are enrolled in school. If they are not enrolled in school, they will be dropped from the rolls. The big thing about CHAMPVA, I want everybody to read this. Read this in the yellow. You don't have to read it out loud. Read it to yourself. I'm going to read it out loud. CHAMPVA members can enroll in an MA-only plan. Enrollment in an MAPD or PDP will disenroll the member from the VA's med by mail. That's not, that word will disenroll is cast in stone. You can count on it. It's like vultures looking for a dead carcass. As soon as they see the MAPD and PDP, they're going to swoop down on it. Okay? CHAMPVA will not pay out of network if the MA plan does not. Okay, so, and I purposely left this off until I got here. If you are this is why most MA plans are PDPs. I know there's some out there that like to play the odds and are HMOs. I understand that. But most MA plans are PDP because you're going to find more TRICARE For Life than CHAMPVA people out there. TRICARE For Life, if they want to go to a doctor that's outside of network, all they've got to do is call TRICARE. And TRICARE, unless, Dr. We Stick 'em and How has got a bad reputation, the chances are they're going to approve Dr. We Stick 'em and How to treat you, and they'll pay the additional cost because it's still going to be lower than what they would probably pay with Medicare. CHAMPVA, not so much. CHAMPVA states it will not cover out-of-network doctors. So if they have a PDP, if that doctor's not in network, it doesn't matter if they have a PDP, HMO, MOUSE, it doesn't matter. They're not going to get paid for that out-of-network. So that's the big thing to know about CHAMPVA and TRICARE For Life when it comes to out-of-network. Again, lo and behold, our same chucklehead doctor doesn't know how to go ahead and dual bill for CHAMPVA, but not your heartbeat trouble. Same, just about the same form. Fill in light blue areas. You do it twice in 30 minutes or 30 seconds. 30 seconds. Attach the available paperwork. It's who you are, who you are, where you went, what you spent. Send it in. Lo and behold, 10 days to 2 weeks. The reimbursement ferry sprinkles you with fairy dust, and you get your co-payment back. And this is the VHA form, or VHA 107959 form. So, and then the GWIS differences between the two. Folks, we have to understand, we started this program, or a little bit into the program, about benefits and what the purpose of the VA is. The purpose of the VA is to provide benefits for our veterans. They have people in place. They're called VSOs, Veteran Service Officers, and you can find them what's known as a Veteran Service Office. They are in every county. They are required to be in every county, in every state, in the United States. Are they at 100%? No. They're going to have, because some people become sick, broke, or dead, right? Or move on to different careers. So there's going to be some offices that do not have a VSO, but there will be a VSO assigned to them from an adjoining office or county. And their sole purpose for breathing is to find benefits for veterans. So, they are evaluated on how many veterans they have. And the same thing, every service-connected organization, whether it's AMVETS, DAV, Veterans of Foreign Wars, the Marine Corps Glee Club, whatever that they have out there, as a service-connected organization, has embedded with them individuals that are not VSOs, but have gone through the training and are able to help veterans with their benefits. So you as an enterprising entrepreneur that's wanting to 10x their business, and you don't mind going out there meeting people face to face, you knock on the door and say, "Hello, Mr. Veteran Service Officer. My name is Joe Walker. I'm with Global Premier Benefits. I want to take a few minutes to help you if I possibly can. I want to help you understand what we do, how we can help you help your veterans. And I understand that you are your sole purpose here is to provide benefits for veterans, but we have additional benefits available for your veterans, our veterans, at no cost to them. I'd like to take you out to lunch, talk to you about the details of this program, see how we can partner together. I even got resources available where if you want to go out and do a Veterans Appreciation Day, or hey, let's talk about Medicare event or something like that, we can help sponsor that for you. And at the meantime, I run across a lot of veterans. I need some of your cards, some of your contact information, because I have several veterans out here that I know of right now that I can filter toward you or funnel toward you, that you can go ahead and help them with their benefits. And that's going to help you. You've helped them. We all win. What's a good day to take you out to lunch? And folks, if you try and do that over the phone, they're going to go, click, and you'll never hear from them again. You'll kick the door down, see them face to face, shake their hand, give a good big hug, then walk out. It's just, you got to see them face to face. But it really, if you'll do that, you're going to find that they're going to be there and want to support you, because you're supporting them. You're helping them help veterans. So I think I went a little long. So That's about a 50,000 foot overview, but hopefully it'll whet your appetite and get you to the point where you realize that, holy mackerel, this is a great opportunity. I'm going to choose to do it.